The Israel-Hamas war is more than just a tragedy for children. So far, thousands of them in Gaza have reportedly lost their lives. Our Lee Eun-hee spoke to an official at a charity organization for children in the occupied Palestinian territory about what the situation is like there.
Since October 7th, over 29,000 people have died in Gaza, and more than 40% of them are children. Jason Lee, Save the Children's country director for the occupied Palestinian territory, says that a ceasefire is the only way to prevent more children from dying.
And again, it's so important because children need to believe that they have a future, that they will survive tomorrow, they'll have a future, rebuild the health facilities, rebuild the schools, rebuild the homes. But the first step is really the ceasefire.
There's also the impact on their mental health.
They see that their homes are being destroyed. They see their families being killed, their communities destroyed. They hear the fighting, they hear the airstrikes, the machine guns, the shelling, the tanks.
He shared the story of a 4-year-old girl whom he met in Gaza in December last year.
We have no idea who she is, how she got there, or where she came from. And she was in such a state of catatonic shock. She wasn't speaking, cold and clammy, really, and we had no idea when she last ate.
He says this is just one story of at least 17,000 children who are estimated to have lost their family. While they have no one to take care of them, humanitarian aid entering the Strip is becoming even more challenging. Rafah is congested with displaced people living out in the open, and access to other regions is not allowed by the Israeli Defense Forces.
Again, we have not been able to get to the north of Gaza. We've not been able to distribute to the middle areas of Gaza. And moving in Rafah is becoming more difficult because it's the congestion. I mean, none of the roads are passable right now. The trucks can't get through. We can't deliver enough supplies, and the people are desperate.
Israel's full-scale ground operation in Rafah means the children will be either killed immediately by the fighting or die from starvation or as a result of public health emergencies.
We already see diarrheal diseases increasing. It's cold, it's wet, they will get pneumonia. And what happens if there's cholera? So all of this will happen to civilians. We will see the morbidity and mortality, especially for children, increase.
70% of injuries have been either a woman or a child. Children are more susceptible to malnutrition and diseases and will die quicker. The lives of Gaza's 1.1 million children depend on an immediate and definitive ceasefire. Lee Eun-hee, Arirang News.